Hello and a very warm welcome to your favorite news destination. I'm Kabir Naqvi. And you know what? Only recently we held a discussion here in India Ahead about how the times are changing so fast. I personally expressed my concern and anxiety while sitting here speaking to the multitude, being genuinely scared that something might end up happening to me. And I only said the same because of the recent spate of heart complications and issues amongst the young adults in particular. The latest addition to this list of gone too soon is, of course, comedian star Raju Srivastava, somebody who's paved the way for the entire comedy industry to blossom. But so on. Take a look at some of these other deaths. Actor Siddharth Shukla, Kannada superstar Puneet Rajkumar, both fitness freaks at a young age, sooner than they should have. Singer KK. All these heart attacks have sent shockwaves across the country. Now, the chairman of Narayana Health, Dr. Devi Prasad Shetty, somebody who's a very renowned voice when it comes to cardiology, has advised all people above the age of 40 to get a CT angio or a heart CT scan at least once every 10 years. The scans will help in detecting minor coronary diseases. Before we begin, let's quickly take a look at what Dr. Devi Shetty had to say.
On the occasion of World Heart Day, if you are past the age of 40, please, at least once in 10 years, get a CT angio or CT scan of your heart. That will detect even minor coronary artery disease and prevent heart attack in the future.
Well, now, Dr. Devi Shetty, he also said that many young and middle-aged actors, celebrities, and other fit people who suddenly drop dead after a heart attack could have been saved. Their heart condition could have been diagnosed 10 years earlier if they had undergone regular scans. Now, what kind of problems does one go through at this point in time? What are preventive measures when we're talking about our hearts? Does the COVID vaccine here have a role to play, like many people are suggesting on the internet? Let's not forget the internet is completely divided on that point. And post-COVID-19 complications, what kind of role does that particular complication play? Or is it just another one of those health trends that we suddenly take up, follow, and then we forget about it as well? Well, to answer all these questions on our Dil Ki Baat, we have an esteemed set of panelists on the show. Joining us on the show is, of course, Dr. O.P. Yadav, CEO and Chief Cardiac Surgeon, National Heart Institute. We have Dr. Mohsin Wali, cardiologist and former honorary physician to the President of India. We have Dr. T.S. Clare, Chairman of Fortis Heart and Vascular Institute, Fortis Hospital, Gurugram and Vasant Kunj, and Dr. Samir Gupta, Co-Chair, Healthcare PhD Chamber of Commerce and Director at the Cardiac Cath Lab Metro Group of Hospitals. A very warm welcome to all of you. Doctors, I'm going to start rolling this ball and this dice over here. Let's go to Dr. T.S. Clare, of course. Dr. Clare, do you think this is something that we need to worry about? And why I'm asking you this question is because tell us about the numbers. Have the figures really gone up? How can we scientifically substantiate these claims that, okay, look, you know what, health complications is something that we now suddenly need to look at all over again?
Well, first of all, thank you for inviting me to this very, very important show. I think, first of all, that we really don't have data in this country of heart attacks at different ages. But what it appears from my experience that the heart attacks are generally occurring more in younger people now. We never used to get patients with the heart attacks in 30s and in early 40s, or even now we get even early 20s sometimes. So I think there is a real increase in number, but at the same time, it is also possible that because of media, because of more access to the information, so we are having this information more and more.
Well, be it a political crisis, doctor, or be it a health crisis, everybody quickly comes and puts the blame.
More aware of these things. But certainly there seems to be some increase in the heart attacks in young people.
Why, Dr. Clare? Why do you think? I mean, you're backing on your experience here. Why do you think it is that suddenly these youngsters are, thronging our hospitals, getting their hearts checked?
Right. So I think there are multiple factors. The factors are that in the past couple of years, what we have seen is increasing incidence of obesity in young people, good amount of smoking in young people, and lot of stress, people working in multinational companies, working in odd hours, and lack of exercise in these young people. And I think on the top of that, I think partly it is also because of most like this is what I think the most likely a post-COVID phenomena, because the people who got COVID, even some of the people got COVID infections without the proper diagnosis, because we all know that COVID does increase the coagulability of blood, and when you have increased coagulability of blood, the chance of heart attacks increase. I think there is a partly COVID effect and partly fundamentals in lifestyle changes, more diabetes, more obesity. Those are the reasons that we are getting.
Absolutely. Let's try and probe this post-COVID angle here a little bit more. Dr. O.P. Yadav also joins us here on the broadcast. Dr. Yadav, how are you looking at this entire COVID-19 debate around heart attacks? There is, of course, the booster jab, and then there is the post-COVID complication. For the benefit of the viewers here, first, how about you help differentiate between post-COVID complications and how the COVID boosters could essentially, allegedly be playing this role here, and does the public need to worry about it?
Well, you always calculate what is called the risk-benefit ratio.
Okay.
So even if you get one odd complication with the vaccine or by the booster dose, the advantages are overwhelmingly in favor of the vaccine. And in any case, the absolute numbers of the complications of the messenger RNA vaccine in terms of myocarditis or inflammation of the heart are so low that I don't think any individual should worry about the complications of the vaccine. However, the complications of the virus itself, yes, one should be very wary of. We all know it causes inflammation of all the layers of the heart. As Dr. Clay said, it increases the clotting power of the blood, so clots can form in the arches of the heart and you may get heart attack. You may get irregular rhythms of the heart, and those patients who have got heart failure, their condition may even deteriorate and worsen during these times. So these are certainly effects of the COVID one, what should be careful about.
Absolutely. And you mentioned risk-benefit ratio, where, of course, in your perspective, the vaccination, of course, certainly wins. But experts have put out this study where they're saying there is no essential link between the COVID booster jab and the heart ailments that have come to light. Of course, social media is flooded with these questions. I'm being asked these questions on Twitter as well. These vaccines have been called quaccines now on the internet. Would you like to sort of dispel these rumors or these anxieties in the common public?
Yes, in most uncertain terms, I would like to clarify that the incidence is very low. We have data which is most exhaustive, which is emanated from Israel of messenger RNA vaccines, and the incidence of post-vaccination or post-booster dose myocarditis is extremely low, 1 in a million kind of a thing. So really, you shouldn't worry about it, most certainly.
All right. Dr. Mohsin Wali also joins us on the broadcast, cardiologist and former honorary physician to the President of India. Now, of course, the President is, of course, that a really crucial post as well. But not just the President, every life matters, doesn't it, at this point in time? Now, the youngsters, T.S. Clare was talking about how there is more smoking that is being done. There is more stress. Obesity is such a huge factor. Are these the only reasons, or are we missing some of these pointers in the list?
Yes, thank you very much for inviting me on this very auspicious day for all of us.
Right, Doctor.
It's for the whole world. World Heart Day is important. And this is an important mission, especially after COVID, as Dr. Yadav was saying. And I always tell to my viewers that heart is the only organ which beats from the womb of the heart till the last breath of our life. And specifically, we have been seeing sudden cardiac deaths after the COVID. And we have to have a mission for saving the heart. And you are rightly doing this program on the World Heart Day evening. And I'm very fortunate to be speaking to the viewers to have a lifestyle modification, because this is a preventable cause of death.
Right. So how do we prevent it? How do we prevent this, doctor? What is that lifestyle change that we need? I mean, we've been speaking to nutritionists. They say that, eat your greens, do a bit of exercise. But I think this is something everybody knows, but we seldom do. And I know this is a case of how disciplined you are and how much of, routine you give importance to in your everyday life. But what are some of those things that we're missing in our lifestyle modifications? Give us those tips and tricks. How does one turn this thing around?
The dilemma is that everybody knows, nobody follows it. This is the dilemma. We can give speeches on smoking cessation, we can give speeches on diet restriction, maintaining ideal weight, maintaining ideal BMI, having right kind of food, exercise. But since this is a preventable cause of death, I am using this word, preventable cause of death, because all the lawyers sitting in your panel, they would agree with me that this can be prevented, preventable cause of death. And recently we have seen young cardiac death. And post-COVID also we are seeing new things. So right food, right sleeping, right stress, being positive is very important these days. We don't have to have irsha, negative thoughts, and thinking bad about others. We have to be positive, and we have to be all brotherly to everyone, and that prolongs our life. And this is very easy to say, but very difficult.
One way to keep.
And then comes the right sleep habits, and then comes the right food. And I would add here to what Dr. Yadav was saying, that very recently on 22nd of this month, a study has come from Stanford, in which they have shown the COVID virus stays in the fatty tissue, and it becomes its home. And from the epicardial fat, it attacks on the coronary arteries and heart muscles. So this is a very recent study which shows that COVID becomes a home, fat becomes a home to the COVID virus, and then it is causing sudden fatality, which we are seeing people walking, people working on the stage, performing on the stage, singing on the stage, and they are dying. So this is very important post-COVID scenario. So we have to be very carefully see those patients, follow up those patients who have recently suffered from COVID virus, from COVID disease, and they are long haulers, what we are calling them, and this long haul is not going to end soon. So apart from maintaining what we are discussing times and again, the right sleep pattern, right food habits, maintaining ideal BMI and weight.
And something very interesting that you pointed out, Dr. Wali, about the fatty tissue that becomes home for these, the post-COVID ailments. The fatty tissue is sort of a home, but you also very nicely pointed out that, loving thy neighbor is one of those ways to get rid of a heart ailment as well. Dr. Sameer Gupta, Co-Chair, Healthcare, PhD, Chamber of Commerce and Director, Cardiac Cath Lab, Metro Group of Hospitals, is also with us on the broadcast here. Sir, we were playing that graphic out of what Dr. Devi Shetty actually had to say. And why only above 40 people? Of course, two things that arise out of that statement particularly. Number one, why is it that us Indians, irrespective of our age, don't really give much impetus to CT scans or CT angio scans and, hefty medical terms like that? Seldom do we go to the hospital for these scans as well. Why is there a lack of awareness? How can we treat this lack of awareness? And why only above 40 people, above the age of 40? Why not those below the age of 40?
Yeah, I think, Kabir, thank you so much for having me on this distinguished panel and for actually talking about this very important topic. I think what Dr. Devi Shetty is basically implying is that, we need to kind of try and prevent disease and catch it earlier than it actually happened. And I think a very important part of this entire paradigm for trying to find disease early is actually, like you said, going and getting yourself tested on a routine basis. We need to be cognizant of some of the risk factors that are there, whether it's diabetes, hypertension, high cholesterol, all the other distinguished panelists have mentioned that, that it's easier to say than actually walk the talk, right? So, whether it's good food, eating nutritious food, the food that we eat is not really nutritious. We eat food, but to give you a small example, a packet of bhujia, right? A packet of bhujia, which most people just consume on the drop of a hat, has about 800 grams of sugar, right? 800, sorry, of salt, of sodium, 800 grams of sodium. That's a lot of sodium, right? So actually trying to make those changes in eating good, nutritious food, exercising regularly becomes very important. You were talking about, can we try and prevent disease? And now the question is, can we catch it early? We have to recognize the risk factors for heart disease. Some of the big risk factors are diabetes, hypertension, high cholesterol, and family history, right? We've already talked about diet and nutrition, but these are some of the big risk factors that come up. Now, most of these risk factors do not have any symptoms, right? I often meet patients every day, just like my entire panel does, and they come to you and they say, you know what, my cholesterol is high, my LDL cholesterol is 200, my total cholesterol is 500, something along those lines, and they'll be like, I'm not feeling anything. Why should I take medicine? What is this all about? All these diseases are what you call silent killers. Okay, you will not have any symptoms, but one day it's going to create havoc because inside your body is trying to cope up, and it's causing, these diseases are causing damage. So it's important to go and get yourself tested on a routine basis. What that routine number is, for some people it may be once a year, for some people it may be once every couple of years. That is to be individualized to that particular person. But get your cholesterol checked, get your diabetes checked. If you have a family history, please get all these things checked. Eat good food, exercise. Oftentimes, the international recommendation is about 30 minutes of exercise 5 times a week. Now, when you go out in the park or wherever it is that you go walk, you go see people. Most of these people are just walking. They're not exercise walking. Your heart rate needs to go up. You need to, stress.
There is less aerobic and cardiovascular stress on these hearts. And at the same time, I mean, the community is divided on kind of exercising as well. We have hyper-intensive interval training and all those kind of things that have now made their way into the mainstream. And, people pushing the limit, really getting it out there. We were just putting those visuals out of Siddharth Shukla, Puneet Rajkumar, really fit superstars who really pushed themselves to the level. Dr. T.S. Clare, those visuals that had come out about a young girl dancing in front of blaring speakers, then suddenly falling down, a person who was dancing on his birthday, then suddenly collapsed. What do you make out of these particular visuals? Ram Leela play going on, suddenly one of the characters just suddenly strikes down and he falls down and he's no more.
See, a few comments I want to make. Number one is that my other colleagues have talked about the prevention. There is a clear data available scientifically that if we adopt a healthy lifestyle and we have an annual health checkup, the 70 to 80% of premature death because of cardiovascular disease is preventable. 70 to 80%. So that is one thing we have to realize. That's number one. Number two, when we talk about annual checkups or regular checkups, hardly 2 or 3% of people in India do that. What needs to be done is only checking your blood sugar, checking your cholesterol, and checking your hemoglobin A1C is more than enough. A physical examination, and people more than 30 years of age, maybe a TMT every 2 years, but people where there is a high risk for diabetes, family history, there I would recommend exercise tests every year should be done. I differed with Dr. Shetty to recommend CT scans because no country in the world, even United States of America, can afford this kind of expense on routine basis, and it is not really required. If we have the physical examination, if we have these simple tests to be done, and TMT and echo in selected cases, I think that will go a long way to prevent heart disease in India. Secondly, I would recommend that as we have some program, national malaria prevention program. Similarly, we need a national program of cardiovascular disease prevention. There is none so far in the country. So that is what we need to do in this country.
Actually, great
now
show.
Coming to the question of somebody dancing, falling on the ground, one should differentiate between apparently healthy looking person versus medically tested healthy person.
Absolutely. I mean, it is such a great thought that we need a national level drive.
We don't know whether they smoke or not. So we don't know what is your family history. So all those things have to be taken into account.
Absolutely. I mean, we certainly do need at a national level a cardiovascular study as well. Dr. O.P. Yadav, I know we've been through this question so many times, but just to again refresh the memory of the viewers, and for their benefit as well, what does one do if one has to quickly administer CPR? What are some of those things that one needs to bear in mind if they see, an incident of heart attack in front of them? Very quickly, sir.
Well, straight away one must first reconfirm the findings that the pulse should be felt. If there is a trained bystander, he can feel for the carotid pulse in the neck. Put the patient flat. Don't put anything in the mouth in form of water or sprinkling, water on his face. Put his face on the side so that the tongue does not fall back and block his airways. That is one of the most common causes of catastrophe, when the tongue falls back or foreign material goes into the airway. And if confirmed, then we should do what is called chest compressions along with assisted respiration. You should immediately raise an alarm so that, trained manpower can be commissioned, and you should start pressing the chest, and a ratio of 15:2 means 15 chest compressions. And those chest compressions must be really compressions which put the chest wall down by at least 2 inches so that the heart gets compressed between the front of the chest and the spine and expresses the blood out. If you are just doing sham movement of few millimeters, that doesn't give a compression to the heart. And if you are sure of the patient that he doesn't suffer from any disease, or maximum you can put a handkerchief on his mouth and they give mouth-to-mouth respiration, 2 breaths for every 15 chest compressions. And that should be continued till support comes to your hand.
Well, so 2 breaths per every 15 hard chest compressions as well. Dr. Sameer Gupta, you were talking about how you get patients who say that, my numbers are real up, but I don't necessarily feel anything. Why should I, take any sort of medicine? When should one go check with a doctor? And what are these actual terminologies? What numbers are we looking for? Very quickly.
I think you should get yourself tested at least once when you're in your 30s, depending upon your risk factor profile, or earlier if you are, if you have a strong family history, you might want to get yourself tested earlier. And depending upon what test you are getting, the number is going to vary. So, for a cholesterol, that number may be 130 for some, 160 for somebody else, and talking about LDL cholesterol over here. So, that number is individualized to that patient to determine the risk factor profile, when to start medicines or not. But like everybody has said, that it's important to get yourself tested. And I know that a lot of organizations, companies, insurances do offer this, but people don't often get it.
All right. So I think the larger message that has come about on prevention, on what kind of habits should one go through, is that, of course, there is lack of data here, and there is a risk-benefit ratio when we're bringing the COVID-19, angle into this debate, where, of course, it has been told by the experts and the panelists with us today that vaccine definitely wins. It is preventable, was a debate of the past. We have taken steps forward. We're now talking about if we can catch it early. We spoke about the risk factors and, of course, a national level cardiovascular study that should be on the cards as well. Dr. O.P. Yadav, Dr. Mohsin Wali, Dr. T.S. Clare, and Dr. Sameer Gupta, many thanks for joining us on the broadcast. Before we go, Urdu ke Ustad Shair Mushafi Sahab ka ek शेर है. मुसहफी हम तो ये समझे थे कि होगा कोई जख्म, तेरे दिल में तो बड़ा काम रफू का निकला. Take care, take it easy, keep watching India Ahead News.